Hello guys, welcome to Dr. Science. So today we are going to talk about why obese persons are at high risk of getting cancers. So suppose this is a person who is very obese, and whenever a person is very obese and having a lot of central obesity, this central obesity will eventually cause insulin resistance. Now, what is meant by insulin resistance? Suppose, imagine these are your pancreas. These pancreas are producing a substance called as your insulin. Now, here is the muscle. The muscle have a receptor for insulin. Now, imagine this receptor is not working properly. Hence, the insulin cannot come and bind to this receptor. This is known as your insulin resistance because there is resistance at the receptors of the muscles. Hence, this is called as your insulin resistance. So, if a patient is having obesity, especially central obesity, there will be increase in insulin resistance. Increase in insulin resistance at the muscles. Okay, at muscles. So in order to counter this, the pancreas, as you can see here, the pancreas will produce more insulin. There will be hyperinsulinemia. It means there is more insulin produced in the blood. Now this increased insulin will destroy the insulin growth factor binding proteins. Now what are these proteins? I'll explain. So usually there is a compound called as your insulin like growth factor. This is the insulin like growth factor. Now this insulin normally in our body, it is bind to a protein. This protein is called as your insulin like growth factor binding protein. Now if there is increased insulin, it will destroy this insulin growth factor binding proteins. So there will be increase in this will lead to increased in the free insulin growth factor. It means the plasma levels of the insulin growth factor will increase in our body. Now this increased insulin growth factor acts like a mitogen and helps in cell proliferation. This increase in cell proliferation, suppose this is a cell. Unfortunately, insulin like growth factor is coming and binding to this cells. So what happens? There will be decrease in the apoptosis. Not only that, there will be increased in cell proliferation, all which will contribute to cancer. All of these will contribute to cancer. Okay. Normally, in some studies, they found out that the cancerous cells were expressing a lot of insulin like growth factor receptors. So in a study conducted by the pathologist, they found out that the cancer cells were exhibiting a lot of insulin like growth factor receptors. So whenever there is insulin like growth factor coming and binding to this receptor, there will be decreased apoptosis and increased in cell proliferation, thus leading to cancer. So first we will see this diagram which was given in your textbook. As you can see here, if there is excessive of body weight, there will be insulin resistance, which will lead to hyperinsulinemia, means increased insulin production. This increased in insulin production will destroy the proteins such as your insulin growth factor binding protein 1 and 2, and hence the free insulin growth factor will increase in the plasma, which acts like a mitogen and increase the cell proliferation and decrease the apoptosis, thus leading to cancer. So that was about it, guys. Thank you, guys.